talk about something a lot of people have heard of, but maybe don't totally get: Irritable Bowel Syndrome, or IBS. It's a really common condition that messes with your digestive system, but it can show up in a whole lot of different ways. So we're going to dive in and clear up what IBS is, what it actually feels like, and, most importantly, when you should be concerned.
All right, so here's our game plan for this explainer. First, we'll get into the nitty-gritty of what IBS feels like. Then, we'll break down the three main types. After that, we'll explore some of the less obvious signs, touch on why it can be different for women, and wrap up with the really crucial part: knowing when it's time to see a doctor.
So, first things first, what does having IBS actually feel like? Well, the most important thing to know is that it's definitely not a one-size-fits-all deal. Everyone's experience can be a little bit different.
But even with all those differences, there are a few classic, telltale signs that are considered the hallmarks of the condition. So let's look at the common signals that might be pointing toward IBS.
Okay, so it often boils down to these 5 key things. You've got abdominal pain, could be cramps, could be more of a dull ache. It tends to get worse after you eat or when you're stressed, but, and this is a big clue, it usually feels better after you go to the bathroom. Then, there are major changes in your bowel habits, like suddenly dealing with diarrhea or constipation. Bloating is another huge one, and many people get that nagging feeling like they haven't, completely finished. And finally, some people might notice a whitish mucus in their stool.
Now here's where it gets really interesting. IBS isn't just one single thing. You can think of it more like a spectrum, and doctors have sorted it into 3 main types, all based on what your bowel habits are like most of the time.
This chart breaks it down perfectly. If more than a quarter of your bathroom trips involve hard or lumpy stool, that's what we call IBS-C. The C is for constipation. If it's the opposite, and more than a quarter of the time it's loose and watery, that's IBS-D for diarrhea. And if you're constantly bouncing between both of those extremes, well, that's known as IBS-M for mixed. And, how often you go is another huge clue. With IBS-C, you might be going less than 3 times a week, and it could be a real struggle. But on the flip side, someone with IBS-D might feel that urgent need to go 3 or even more times in just one day.
And get this, while all these types are out there, that diarrhea-heavy one, IBS-D, it's the reason a whopping 80% of people end up going to see a doctor about their symptoms. It's by far the most common reason people decide to seek help.
But the story doesn't end in the gut. The effects of IBS can ripple out and show up in some ways you might not expect.
And this is so important because it confirms what tons of people with IBS already know. This isn't just a stomach issue. We're talking about things like feeling totally exhausted, muscle and back pain, headaches, trouble sleeping, and even heartburn. It really shows you how much this one condition can impact your entire quality of life.
Okay, it's also really important to talk about how gender can play a role here. Women are actually more likely to have IBS in the first place, and their experience with it can be pretty different.
For starters, the kind with more constipation, IBS-C, shows up more often in women. Hormones are a huge factor too. A lot of women find their symptoms get way worse right before or during their period. And it's also worth pointing out that women are up to 3 times more likely to actually bring these symptoms up with a doctor, which is probably part of why we know more about their experience.
All right, this brings us to our last and, honestly, most important section. Regular IBS can be really uncomfortable, but we need to talk about the signs that are not typical, the signs that mean you need to get to a doctor right away.
Listen up, because these are the absolute red flags. Things like severe pain, seeing blood in your stool, running a high fever, or vomiting over and over, those are not your typical IBS symptoms. If you experience any of these, it's really time to stop guessing and get professional medical help to make sure it's not something more serious.
So, where does that leave us? We've gone over the patterns, the different types, and those critical red flags. And all of that knowledge, it's a really powerful tool. So the real question is, now that you know what to listen for, are you ready to take that first crucial step toward truly managing your health?